You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello everybody, thanks for joining us back again here at Healing Voices Project. And we have yet another guest. We're approaching 100 episodes now with 100 guests, and I remember every single one of them. But today our guest is Kim Lee. And Kim, I've gotten to know Kim a little bit over the last couple of years, and at MiraVista. Kim is the Chief of Creative Strategy and Development at MiraVista Behavioral Health Center in Holyoke. And Kim has more than 20 years of experience in behavioral health and community engagement. Kim has worked in all kinds of aspects of this field: inpatient psychiatric care, outpatient addiction treatment, public outreach, always with a focus of breaking down barriers. You've led many initiatives that expand access to compassionate mental health substance use treatment, promoting innovative programs like direct admissions and inpatient care, and you champion the message that recovery and healing are possible for everyone. And Kim, there's a lot to your introduction, so I had to read some of it because I just couldn't remember it all. But at the same time,
Me neither, so thank you for that.
Yeah, well, sure. Thanks. You're welcome for the reminder of who you are. But also, too, one of the things that you said when we talked about it, because you've been a passionate advocate for reducing stigma, for increasing awareness, and building partnerships that make it easier for people to get the help they need and recognizing the help they need. And that's what we're all about too, right?
Exactly.
Reducing stigma, increasing awareness, that's our driving thing. So why did it take us so long to get together?
I don't know, Michael, I know, but I'm so glad that you did reach out. I'm so happy to be here. Any opportunity to talk about resources and what's available through MiraVista it's always a great way to start the day.
Yep, and I've been at a couple of events that you guys have had. You do a great job, and you're at the old Providence Hospital.
Correct.
And just for a little sideline, back in the late 80s, I used to work at Providence Hospital. So
Really?
In my job, by the way, this is neither here nor there, but just for a little context, I worked there, and I was the director of environmental services, and I used to joke that I would manage all the departments no one wanted to manage. Housekeeping, grounds, security, transportation, patient transportation, and all the service department, laundry and linen. And as a result, I know every inch of that building.
Interesting.
Every inch of that building, and even the outside with the grounds.
Yeah, that's right.
And I know that, and why I say this, because I'm just so familiar with that building, even from all those years ago. But you've changed it. You've painted it. It looks beautiful.
Thank you, Michael.
It's gorgeous. It's so different from what it used to be. And it's a very large facility. It was a 250-bed acute care hospital back then. Almost 300 beds, actually. How many beds do you have now?
Right now we have 16 beds that are reserved, if you will, for adolescents. So young people between the ages of 13 to 17, 18 if they're still attending high school, will be admitted on the adolescent unit. So we have 16 beds for kiddos. And then we have another 72 beds for adults. So anybody 18 and older who isn't attending high school will be admitted on the adult unit. So in all, we have 88 beds.
Okay. And I jumped ahead with that little, I was rambling on, but...
Not at all, that's great.
But tell us what MiraVista is, what you do, and then we'll get into what's happening there. Like, your guys are growing. I know that you're adding beds, and
we are.
You got a lot of different programs going on. So just for people who are unfamiliar with MiraVista, what is it? What are you? What do you do now?
What do we do?
Yeah.
So we are, and to your point, Michael, and thank you for that little bit of historical context and perspective, because individuals will hear MiraVista and they're not sure where we are or what it is that we do. So I usually begin an introduction to MiraVista by reminding folks or informing them that we are what once was Providence Behavioral Health Hospital. So we are right there on Main Street. And it's interesting, Michael, because when I mention that background, three things will always come to mind for individuals. One of three things. One is they were either born there, two, they worked there, or three, when they were young, their family would drive to the front of the building to see the Christmas tree lights that were always on top
So I can check off two of those boxes.
of the building.
Here.
That's
Okay.
right, absolutely. And actually, I should say four, because I guess at one point the cafeteria was open to the public, so people remember eating there as well. So we, the Trinity Health system made the decision back in early 2020 that it was going to close that facility. So the state, upon learning that, reached out to our ownership group. We have a sister hospital, MiraVista, which is in Devens, Massachusetts. And so the state reached out to that ownership group and said, you know, we really do not want this facility to close. We really do not want Western Massachusetts and this part of New England to lose access to those inpatient beds and the outpatient substance use treatment that it's now being provided. And our ownership group agreed and pretty quickly made the decision to absolutely purchase the facility. So one of our owners actually grew up in Longmeadow, and his father was a medical professional. And so he grew up valuing and appreciating the importance of both primary care as well as behavioral health care. So the decision was made, and in 2021, we reopened as MiraVista Behavioral Health Center. So we are a large inpatient psychiatric hospital, also providing outpatient substance use treatment. So we are providing, again, beds for adolescents as well as adults. And then on the outpatient side of things, we are providing access to methadone, other medicated assisted treatment, as well as intensive outpatient programming for substance use treatment.
Now, when people, do you take direct admissions or do you get referrals from other partners?
We absolutely take direct admissions. And in fact, direct admissions is really quite innovative, and it's changed the landscape.
Is that recent?
It actually, I want to say it's probably within the past year that it really has gained traction, not only within our hospital and our sister hospital, MiraVista, but in the community and among providers as well.
Okay.
So in the past, if an individual needed to access an inpatient level of psychiatric care, they'd have to go down to the emergency department. The emergency department was always the go-to, and that is no longer the case.
You'd have to go to the emergency department first.
You would.
Okay.
You would. You'd have to go down to the emergency department. You'd have to stay in the emergency department for some time until you were evaluated and or medically cleared. And then the hospital would send out an assessment, a referral, if you will, to psychiatric treatment facilities, and hopeful that there would be a bed available.
Okay. Is insurance required?
Insurance is required. Insurance is required. I will say, insurance is required in the sense that an inpatient experience can be costly. So we do and have in the past accepted individuals, or admitted individuals, I should say, who have paid out of pocket for services. But we accept all major insurance carriers and also Mass Health.
I'm going to ask a question. Once somebody does get admitted, if they go directly or by referral, what can they expect?
Oh, what can they expect?
Yeah.
So,
Yeah, I mean, that's a big. There's a lot more to what can they expect for treatment, duration,
yes.
and all kinds of things. What happens when you walk through
when
those
you
doors?
walk through the door. So
Yeah.
when you walk through the door, actually, one recent change we made, which has been so beneficial for patients who are being admitted, is in the past, those admissions would happen in a staging area or the intake department, if you will.
Mm-hmm.
Now, those admissions are happening right up on the unit. So the nursing staff, the mental health technicians who are helping to admit you into the hospital are the same faces, the same clinical team who you'll see throughout your visit. So it makes for a much more warm and welcoming experience to know that the next morning or the next night you're going to see
The familiar faces.
Nurse Kim or the mental health technician. So it is a much kinder, gentler process to entering into psychiatric treatment.
And I suppose you adapted to that method as a result of some of the challenges that you've encountered when somebody did get admitted and there was a disconnect.
Yes.
Is that what are some of those other challenges that you tried to overcome?
I think, in terms, Michael, of stigma and helping people to understand, the public to understand that just as you would for a broken bone or for a bad back or for, upper GI issues that you might be experiencing, you'll seek physical care and or treatment for those symptoms. But it is not as common, if you will, when we're struggling with anxiety, when we have debilitating depression, when there is, a diagnosis of schizophrenia or bipolar. To seek treatment in that way is not always as immediate and or deliberate. There's a lot of questions around, to your point earlier, what happens in a psychiatric hospital?
Yeah.
And it really isn't any different than a medical facility in the sense that there are psychiatrists, there are doctors, there are nurses, there are groups that happen during the day so that you can work on your mental health, be treated for your mental health, so that at the time of discharge, which is usually within 7 to 10 days, longer or shorter based on medical necessity,
Okay.
but you're ready to re-enter your life having felt supported and treated so that you can live your best life.
And to be diagnosed correctly, you have to be able to, I'm going to say something that's kind of obvious, but people have fear, they have anxiety, and so you can't readily just see through all of that like you can, like, oh, you broke your knee.
Right.
It's hard to identify, especially when you're trying to get through that fear, anxiety, paranoia, stigma,
Yes.
all of those things.
Absolutely,
right?
Michael.
So,
And it's interesting because we will from time to time have patients who will come to us for medicine management. So they had, let's say they've been diagnosed years ago, they've been taking a certain prescription or a certain medication, and it just isn't that helpful anymore, and they're no longer stable. So inpatient treatment or care at MiraVista is also an opportunity for individuals to level set, to talk again with the psychiatrist, to talk with our clinical team, to get the supports that they need, and a change of medication if it's
So
necessary.
besides the inpatient, you have the outpatient services that,
We do.
because that gets ongoing, obviously. And
We have many people who come to us, Michael, are dual diagnosis. So if you have a primary diagnosis of mental health, we are able to detox inpatient at MiraVista safely. And then when it comes time to discharge, we have medicated assisted treatment, we have outpatient substance use counseling, we have an intensive outpatient program for substance use. Our clinical team, our social workers, discharge planners will make sure that every patient. In fact, by virtue of our licensure, we are mandated to be sure that every patient who leaves us has an aftercare plan.
And with that, too, it's the importance of the community and other organizations that you collaborate with. There's got to be a real, for lack of a better word, teamwork, sort of, right?
Very.
And I know that it doesn't happen in isolation.
No.
So you've got to really collaborate with other, and let's talk about some of the type of companies, not companies, but other organizations that treatment centers that you might work with and how that might work.
Absolutely. Yeah. We work very closely, Michael, with the community behavioral health centers. So listeners may not be aware, but 2 years ago, as part of the Executive Office of Health and Human Services Behavioral Health Roadmap, the community behavioral health centers around the state were launched. They're referred to as CBHCs. The CBHCs, for example, provide 24-hour, 7-day-a-week walk-in access to mental health treatment. So we work very closely with them because individuals who do walk in, who do take advantage of that service, will find themselves in need of inpatient, which is a higher level of care than what the CBHCs are able to provide.
You mentioned kids earlier, and how do you coordinate, how do you collaborate with the schools?
Yes, it's very important.
Yeah.
Very important, Michael, and thank you, because we are, and it's funny, at the beginning of summer, we launched a community effort, a campaign, which focused on the fact that adolescent mental health doesn't take a summer vacation. So when kids are in school, they're surrounded by a network, a community, a caring environment of guidance counselors, teachers, administrative staff, gym teachers, sports coaches, people who keep their eyes and ears open in terms of the overall health and mental wellness of our young people. But suddenly when summer comes, those supports are lost.
You find there's a gap then?
There's a gap,
Yeah.
and especially for kiddos who are in rural areas where there's a lack of connectivity with their peers. So every day in school, you knew you were going to have lunch with Mike and Kim, or you were going to go practice, track and field with Les or whoever it might be. But when schools are out, that connectivity is lost, and isolation can set in. So now, going back to fall and going back to school, we've started another outreach effort, which is, making sure that you're keeping mental health on your back to school checklist. We make sure kids have backpacks. We make sure they have pens and pencils and folders and highlighters and new sneakers and backpacks. But how about their mental health? Are they ready for the transition? Is there, anxiety on their part about going back? And how is that all handled?
You've been doing this for 20 plus years now.
Yes.
Do you see a difference in how this was handled 20 years ago versus now?
Oh, absolutely. And even beyond that, Michael, it's funny. I have anxiety, and I've had it most of my life. And when I was a teenager, I thought for sure that I was clairvoyant. I thought for sure that the butterflies in my stomach
Told you something.
Told me. It was forecasting. It was foreshadowing an earthquake or, some significant event. Oh, until my parents said, yeah, Kimmy, that's called anxiety. Let's talk about it. My mother actually was a guidance counselor in the Springfield school system, but she also taught in Springfield as well as West Springfield.
Was it the same school you attended?
No, it wasn't. It wasn't.
So you didn't see her walking down the
I
halls?
didn't see her. No,
Okay.
Actually, no. And thank goodness, because there were
I
times
get
I wasn't the best student.
I get it.
But
Can't imagine that.
but you do, you look back and so many people now in their adult lives are, getting the treatment that they may have needed for so many years.
Because when it's undiagnosed, it can certainly turn into something else, and whether it's addiction and other things that happen. You know, it's a tough thing that you deal with, and you and your staff, and I've met several people on your staff, wonderful people.
They are life changers.
Sometimes, yeah. Well, and I guess that's what leads me to the thought is, how do you get up every day? What keeps you going with this type of work? Because it can weigh on you.
Yes.
What keeps you going? Is it the success stories? Is it something is saying, I've got to keep this going, and where it might defeat other people?
You know, what a great question, Michael. And so don't quit your day job, because you're doing, this is fabulous. you are, this is so great. And what a great question. It, you know, Michael, I've always been, you know, my first job right out of college, actually while I was still in college, was at the United Way of Pioneer Valley. So from a very young age and very new in my career, I was part of what is called or considered the caring force. And I have a real passion for making sure and doing my part.
Did you get some of this from your mom?
As best I can, yeah. And my dad, and you know, I grew up in a family that just really appreciated being helpful and, you know, validating people from all walks of life at some time in their life are going to need help. And to know that I can be a liaison for them, I can be a conduit, I can help them bridge that gap, is really, really, it's truly motivating, Michael. And, you know, to have, I received a lovely card the other day from a couple whose grandson was actually at MiraVista. And they wrote a very kind note to me and to all the staff, and I have them in my office because, you know, it's not beds, it's people. And I would want to know, as a mom, you know, my husband and I have 2 girls, 23 and 25, and I have always said while they were growing up that I would want to know that somebody was going to treat them with kindness and respect and be responsive. And so that, even to this day, keeps me motivated, because it's somebody's son, it's somebody's mother, it's somebody's brother, and they deserve somebody who's going to be respectful and responsive.
Yes, I 100% agree with that, because oftentimes people, don't recognize there's an issue, they ignore it, they think it'll go away,
right?
And that certainly perpetuates into a larger problem most times.
It can.
Right? And if someone was struggling or unsure or just said, what's wrong? It's particularly with young people. And we talk about the young people a lot here, but what do you recommend for somebody who might be struggling? What is the first call that they make to say, what do we do? How do we handle this? Where do they turn?
Absolutely. There are so many resources now, Michael. It's almost overwhelming and can be overwhelming.
That's why it's confusing, actually.
It is. And it's interesting you said, 20 years. So, all those years ago, there were so few resources. And today, there are so many wonderful resources that are available. We have, in the state of Massachusetts, we have a Massachusetts Behavioral Health Helpline. However, SAMHSA also operates 988. So 988 is the number to call if you are feeling suicidal, if you're just looking for help, if you're looking for a guiding voice to help you with a next step. So those phone operators, if you will, are all mental health professionals and clinicians who can then guide and direct you.
They'll have a conversation and try to think, where is this person best to direct to?
That's
right?
it. You can call or text.
988.
988.
Simple.
Very.
One of the things we often say, which I didn't know the answer to, because when I first started getting involved with this, who do people call? And how do they know who to call? And after what I've learned, now with 988. That's very simple to remember. But if you don't know 988, now I've learned, call someone.
Oh.
And it doesn't matter who,
No.
almost, because you could call MiraVista, you could call any other place, and most times either trained professionals who will say, this isn't the place, but
Right.
here's who to call. You will be guided, directed. So just pick up the phone.
Absolutely.
It doesn't have to be the right call the first time.
No,
because it'll get you there.
It's a very good point,
Yeah.
Michael. And,
Yeah.
you know, and I'm going to give out my phone number at MiraVista. And I encourage people to call. I encourage people, because to your point, even though they may not need an inpatient level of care, we can and will redirect them to our community partners and our collaborators. So 413-264-3042 is my direct line at MiraVista. And our website is MiraVista BHC.care. And thank goodness for Google, because if you just put in MiraVista, you're going to find our phone
and it's
number
in
and our
Holyoke,
website.
so if you
And
want to
it's in
even
Holyoke.
zero it down, MiraVista Holyoke
Exactly.
will help with that. You guys do a great job, and it is a very large facility. And let's talk about your expansion, because I know you're saying you're adding 20 more beds by the end of the year,
Yes.
and 20 more early next year. And I have a funny
Correct.
feeling it's not going to stop there. But
We've got a lot of space.
talk about what you have going on.
We do. We actually, yes, we will be expanding the amount of beds that we have available. And really important to note that MiraVista, while located in Holyoke, really does serve New England and the Commonwealth. So we have young people as well as adults who are coming to us from the Cape, from the Vineyard, from Vermont, from New Hampshire, from Connecticut, from Albany, from New York.
And I'll just throw in there, it's very easy to get to because Route 90 and Route 91 are within a mile or two from
A
MiraVista.
stone's throw.
Route 5, 90, 91, it's very easy to get to.
It is
Yeah.
from all points,
Yeah.
right?
Right.
So from all points, north, south, east, or west, we are, and wonderful point, Michael, thank you. We are right off the highway.
Yep.
So it's easy for visitation. And you know, one quick point too, there may be individuals who are in Connecticut or in New Hampshire, for example. We're seeing more and more patients coming to us from New Hampshire just because we are just an hour and 20 minutes away. But there are families who have the barrier of transportation. They're not able to come, they're not able to visit. That shouldn't be a barrier to them accepting the admission, if you will. And the reason why is because technology has afforded MiraVista the opportunity to keep families connected. So if you're not able to come in and actually see your child or see your adult loved one, we'll set up a laptop in the visitation room and we'll connect over Zoom or Teams. There are patient phones right on every single unit. So
you bring up a good point. Two things. One is when they're there and for their time, which could be 7 to 10 days or longer.
Or longer.
Okay. They're not there like in prison, or they're not. They still have access to communicate with their family.
Absolutely.
Okay, so it's not like I can't talk to you for 10 days.
No.
So you encourage that.
We do.
Yeah.
As long as the family is helpful.
Yeah.
You know, right? As long as the family is helpful and
then how? Let's say they were in New Hampshire. How would they get to MiraVista?
So getting to would be so what we learned from our partners in New Hampshire that depending on the insurance that they may have, there is actually through their insurance transportation made available so that they can come and visit their loved ones. If they don't have that insurance, we will absolutely set up those virtual opportunities for loved ones to have a conversation over Zoom or on Teams. So we will book a visit just as we would if we were hosting somebody, and they'll talk through technology.
And when somebody leaves, we visited this, it's not see you later, good luck.
No.
What happens after they leave?
There is we have an incredible team of social workers who create a discharge plan.
Mm-hmm.
And that discharge plan actually starts on day one of their admission. So are they returning to their community of origin?
Mm-hmm.
Are they looking to not go back to their community of origin because they're afraid to use again? They
Right.
don't want to relapse if they've come to us for treatment. So if they're going to live here in Western Massachusetts, we'll work with our housing providers and collaborators.
Mm-hmm.
They're going to need a prescription. They're going to need that prescription filled at their local pharmacy. They're going to make sure that they have appointments with psychiatrists, appointments with their primary care. So that continuum of care, that ongoing treatment is so important to establish so that when they leave, they have everything they need to be successful.
And you're working on that from the first day they arrive.
From the first day they
Yeah,
arrive.
see, that's important. Well, we talked about a lot. You have a lot happening,
We
a lot
do.
of growth,
We
which means
are.
you're having some success.
Very, very much
Yep.
so. Absolutely.
And it's great. So, and you have, MiraVista. Would you mind saying the phone number and,
Sure.
and the website
yes,
again? And
no,
then,
not at
yeah.
all. And I'm actually going to spell it as well.
Okay.
It is MIRA, V like Victor, ISTA, BHC.care. So MiraVistaBHC.care. And then the phone number to me, which I would encourage individuals to reach out to me, is 413-264-3042. And if we're not able to help, we can still lead people in the right direction so they can find
Yes.
whatever treatment will be helpful to them.
Yeah. It's great to know. Great information. Glad you're here because
Thank
I think
you.
it's overdue.
I do too, Michael. Thank you for the invitation.
Sure. Yeah,
Thank
we'll do it
you.
again too.
Oh, I would love that.
And also too, see how you're doing because you're adding 20 beds, and
We are.
maybe by the end of the year, beginning next year, let's see what's happening.
Love that.
All right.
Would love to check back
Well, Kim,
in.
thanks for coming.
And thank you. Be
Sure.
well, Michael.
Thanks.
Thank
And
you.
everybody, thanks for listening again. We'll see you soon.